Hi everyone, I'm Erica Bennett with South Georgia Medical Center, and we're here live today outside of our Dasher Memorial Heart Center, and I'm joined by our President and Chief Executive Officer, Mr. Ronald Dean. And it's been a few weeks since we've given an update here, so we thought it was important to come out and provide you with some insight on what's going on at South Georgia Medical Center. So Mr. Dean, businesses are opening back up, the community is opening back up, and so is the hospital. Can you give us an update on what we're seeing since that's taken place?
I can. We're clearly seeing a downward trend in COVID-related hospitalizations. The number of patients in a hospital bed have been in the single digits for several days now. That's down from our peak when we had upwards of 50 or more at our peak. Number of patients in an intensive care unit bed are way down, and we have not had a patient with a COVID-related diagnosis on a mechanical ventilator in several days. I think that's a very positive trend. I think that's something the community can be very proud of. Although we do see sick patients with COVID, not as many as it was in the beginning, and I can't explain it. What I can say is we are testing more, we are diagnosing more. The number of diagnosed cases in the county are going up. And you all know that we're using the testing center up at Smith Northview for the purpose of those who come that think they have COVID-related symptoms. They're tested. Those that are sent over from a doctor's office that are tested. And then those that are coming here for their surgery or procedure cases are tested. And we are picking up positive diagnosis. But I think the key point is that we're not seeing the inpatient hospitalizations with these diagnoses that we saw in the beginning. Again, not sure what that means. I don't think it means we let our guard down, Erica. I think it means that we're doing something right. I think the community has been very diligent in protecting themselves by social distancing like we're doing today, wearing our masks, washing our hands, cleaning our surfaces. And my encouragement is everybody stay on that path for a while longer. Let's not let our guard down till the science catches up. We will know a lot more about this virus in the very near future, I believe, and then we can explain all that's going on. And at that time, I think we'll be back to some normal that we'll all agree it'd be good to get back to.
Absolutely. In regards to the patients that are being treated here, I know there's a lot of new advancements in treatment for COVID-19. Can you tell us what we are able to offer here at South Georgia?
Absolutely. Very proud to be a part of the convalescent plasma study that's through the Mayo Clinic. We partner with them as a site to administer the convalescent plasma. For those that don't know, that is blood of patients who have been previously diagnosed. They've given their blood. That plasma is used to treat patients through infusion. There is the remdesivir that everyone's heard about, that 85 hospitals through the state of Georgia have received. We're one of 85 hospitals that received this drug, and this drug has been proven to lessen the effects of COVID. We have treated, I believe, 2 patients thus far since receiving it within the last week. The results have not come in yet. It's too early to tell if it's had an impact, but we're very proud to do that. The other thing we're very proud of, not in treatment but in testing, we announced we have the Cepheid molecular platform, and we were able to offer in-house testing through the Cepheid. We now have Cepheid and the BioFire molecular testing platform, which both are FDA approved for in-house testing. That allows us to get a rapid test within 1 to 2 hours on someone, and we're very pleased. And we seem to be getting the test kits for those testing platforms, and it enables us to make the decision quickly, more quickly than waiting naturally 5 to 7 days for a patient's results. So those are very key developments in our battle against COVID, and I think more things are coming as science catches up.
Okay, with outpatient surgery and us really encouraging people to seek medical care now, it is safe to come to our facility for emergent issues and illnesses. What is the data looking like? Are patients coming back or rescheduling those surgeries?
They are. A couple of weeks ago, I reported that our patient volumes were down in the neighborhood of 30 to 40%. We're now in the 20 to 30%. I'd say in the month of May, we were 85% of the patient volumes that we were before COVID. Patients still fear coming, and I can understand that. But what I want to assure everyone is we've taken all the measures possible to make it a very safe place for not only the patients, but their guests to come. We have relaxed the visitation policy for the outpatients and the emergency room patients, and one guest, one visitor can come with each patient and be with them during that time. The inpatient, still no visitors allowed until we feel a little more confident with that. But that doesn't mean it's not a safe place. See, all the cleaning measures that we do are about making sure the surfaces are clean on a more frequent basis than before. And remember, we're testing patients before they have their procedures. And I really believe with that and our enhanced focus on personal protective equipment at all levels and everyone that enters the facility wearing a mask, we can feel comfortable about coming to the emergency room or coming for our outpatient procedure. My hope for the community is that if you need care, that you not fear. Let's follow the facts.
Mr. Dean, there's been a lot of work from our staff behind the scenes preparing for new physicians coming to the community. Can you give us an update about who's coming and what that means in regards to patient care here in South Georgia?
Erica, absolutely. The lifeblood of our hospital is our nurses and our doctors, and we need more of both. And while we've recruited more nurses, we put an emphasis on recruiting more physicians to the community because of the community need. We're very excited to announce that we have a great number of physicians coming, some out of training, some from other areas of the nation to join our team over the next couple of months. Three in particular I would call out. One is an additional family medicine physician that will be located in Nashville, Georgia. That's Dr. Jacqueline O'Kane. And we have an infectious disease physician coming to join us, Dr. Brown. And then we have another neurosurgeon. Neurosurgeons are hard to find, and we have one coming that will partner in call schedules with Dr. Khalil to provide 24/7 neurosurgery coverage. Now, what does that mean? See, heretofore, about 20 days of the month, if someone came to our facility with a neurotrauma, a head injury, or some other issue that needed a neurosurgeon on those days that Dr. Khalil was not available, guess what? They would have to leave the community. Now we'll have that covered. Our goal is to have a supply of physicians in every specialty to meet the demands of the community and the region. We are a regional destination center. These services need to be provided every day of the week. We should not have a lapse because we don't have physicians. So there's a big emphasis on growing the number of physicians to meet the demand. And I think the community benefits from that. Do not have to travel, more specialty services here, and that's our goal. Creating access to specialty care for this region we serve.
Mr. Dean, I'm extremely proud to be part of this team. I mean, if I had to be a part of any organization at this time, South Georgia Medical Center has done a wonderful job in responding to this pandemic and then just moving out of what we've had to respond to. The team has been phenomenal in communication and interacting together, nurses, physicians, support staff.
Yes.
How would you describe that?
So Erica, I've been around a long time, and I'll tell you what you're describing is unprecedented in a lot of ways. This team of nurses, team of doctors, team of healthcare professionals, they have risen to the challenge with COVID, but more importantly, they've remained focused on all of the other work we do here. I enjoy seeing their enthusiasm about serving, and I'm very, very proud of them, and I can't describe it in words what it is that I feel. But what I can say is this: I'm equally proud of our community and the region we serve for trusting us with your care, for allowing us the opportunity to serve. We come here to do one thing and one thing only, and that's to take care of people. And we aim to be better at it today than we were yesterday. We want to make the community proud. I'm very proud of this team. I'm very proud of being a part of this community, and I'm very proud of being a part of South Georgia Medical Center, as you are. And thank you for the opportunity to talk about it, because it's a very exciting time for South Georgia Medical Center. I'd say South Georgia strong, with South Georgia Medical Center sitting right in the middle of it. So.
That's right, we've got a lot of great things going on. Thank you, Mr. Dean, for coming out here today. To our viewing audience, if you want to learn more about Dr. Mackey, Dr. Brown, or Dr. O'Kane, you can go to our website, sgmc.org, or be sure to follow us on social media, and we just look forward to continuing to serve you. Thank you.
Thank you.